Welcome back to the Deep Dive. Today, we're getting into something that affects, well, millions of people around the world, infertility.
It's a huge issue.
Huge! And did you know male factors, they actually contribute to something like 40, maybe 50% of all infertility cases. It's a staggering number.
It really is. And what's kind of grabbing headlines now is how artificial intelligence, AI, is stepping into this really sensitive space.
Yeah, sensitive and often, quite heartbreaking for the couples involved.
Exactly. And what's truly fascinating here isn't just that technology is offering solutions, but why the older methods often came up short.
Right. What were the limitations?
Well, it's not just about finding the sperm, it's about how fragile these cells can be. Conventional techniques, sometimes they can actually damage the sperm, cause DNA fragmentation, and
Yeah.
that directly hurts the chances of a viable embryo.
Okay, so damage is a key factor.
A big one. So our mission today in this deep dive is to really unpack the story of this system called STAR. It was developed at the Columbia University Fertility Center.
Okay.
And it's designed specifically to tackle severe male infertility, particularly a condition called azoospermia.
Azoospermia. Let's talk about that and maybe start with, well, the impact. I heard about a pretty amazing case.
Oh, absolutely. To really get why this tech matters, look at one of the early results. This isn't just lab work, it's genuinely changing lives.
Okay.
There was this landmark case, a couple, they achieved a successful pregnancy after, get this, 18 or 19 years of trying.
Wow, nearly 2 decades.
19 years, and they'd been through 15 failed IVF cycles. 15.
Incredible. So the obvious question is how? How did STAR succeed where, almost 20 years of other methods didn't?
Exactly. That's the core question we want to explore.
So let's step back a bit. Male infertility, you mentioned azoospermia. How common is that?
Well, azoospermia specifically means there's a complete absence of sperm in the ejaculate, and it's more common than people might think. It affects roughly 1% of all men.
1% overall.
Yeah, and among infertile men, it's about 10 to 15%. So overall, maybe 10% of male infertility cases are down to this. It's a significant group facing a really tough diagnosis.
So given how challenging it is, how do the traditional approaches even work? Or maybe how don't they work well?
That's the crux of it. They are often, frankly, quite limited in these really complex cases. Conventional methods, they often just struggle to spot the very, very rare viable sperm cells that might actually be there.
They might miss them entirely.
They might miss them. Or even worse, the methods themselves can be harsh. Think about high-speed centrifugation spinning samples really, really fast.
Right.
That process can actually damage the fragile sperm cells that are present. So you're reducing already incredibly slim chances.
Which just highlights why something new, something gentler and more precise was so desperately needed.
Absolutely, a whole new approach.
Which brings us to AI. Why AI specifically for this kind of challenge?
Well, AI has this incredible ability to analyze just vast amounts of imaging data, right, with a level of precision that, honestly, humans just can't match consistently.
Okay.
So it's become this really promising tool in reproductive medicine generally. We're seeing AI pop up in embryo selection, optimizing ovarian stimulation.
Right, I've heard about that.
And now, critically, sperm identification. It brings consistency, objectivity. It takes some of the human variability out.
That makes sense. So this sensitivity gap you mentioned earlier, is it that humans literally can't see these rare cells? Or is it just the sheer volume, like trying to find a needle in a haystack?
It's a bit of both, actually. I mean, the human eye has its limits, definitely, especially when you're scanning, millions of microscopic fields. Fatigue is real,
Sure.
but it's also the scale, the consistency. No person can look at 8 million images in an hour and keep perfect focus, right? It's just not feasible.
Impossible.
And in azoospermia, finding even 1 or 2 good sperm cells can be the absolute difference maker for a couple. Traditional methods just lack that enhanced sensitivity, but AI, with its processing power, it can bridge that gap.
Okay, so let's really unpack STAR then. You said it stands for Sperm Tracking and Recovery.
That's right. Sperm Tracking and Recovery. It's this really groundbreaking AI system led by Dr. Zev Williams and his team at Columbia University Fertility Center.
And it's not just AI, is it? You mentioned a combination of things.
Exactly. That's what makes it so clever. It's a sophisticated fusion, really. It brings together artificial intelligence, robotics, and microfluidics, all working in concert.
Okay, microfluidics, let's break these down and start with the imaging. How good is it?
It's phenomenal. The high-resolution imaging system can capture over 8 million images per hour.
8 million, wow.
Per hour. So you get this incredibly detailed, comprehensive view of the entire semen sample. It allows the system to spot sperm cells that you'd almost certainly miss with a standard microscope check. It's like going from a slightly blurry photo to an IMAX movie of the sample.
Okay, crystal clear. And then the microfluidics. What does that part do? Sounds complex.
It sounds complex, but the concept is actually quite elegant. Think of it like a tiny, sophisticated sorting system, maybe like a smart sieve on a chip.
A sieve?
Yeah, this tiny microfluidic chip gently guides and isolates the sperm. And the key is it does this without harsh chemicals, without that stressful high-speed centrifugation we talked about.
Ah, so it's the gentle approach.
Exactly. It's all about being gentle, avoiding that cellular trauma, preserving the DNA integrity, keeping the sperm's, delicate machinery intact. All crucial for a healthy embryo, not just finding a sperm. It sorts cells based on physical things like size, maybe subtle movement patterns.
Got it. Imaging finds them, microfluidics handles them gently. What about the brain, the AI?
Right. The AI algorithm is really the core intelligence here.
Mm-hmm.
It meticulously analyzes all that imaging data, those millions of pictures.
So?
It's trained to identify patterns, characteristics, shapes, movements that signal a viable sperm cell. And because it uses machine learning, it actually gets better over time. It learns
So it improves its own accuracy.
constantly. And crucially, it delivers consistent results. No fatigue, no subjective calls like you might get with different human operators. It just gets smarter with every sample it sees.
Okay, that's impressive. And the last piece was robotics. How does that fit in?
So once the AI identifies a good candidate sperm cell,
Mm-hmm.
the robotic components come in. They allow for incredibly precise manipulation and recovery of that specific cell.
Like microscopic tweezers?
Sort of, yeah. But automated and incredibly precise. It ensures minimal damage during the actual retrieval. You need that sperm viable for the next step, like IVF. It's like microscopic surgery, really precise.
Okay, so walk me through the whole process. A sample comes in.
Mm-hmm.
What happens?
Right. So, step one. The sample is processed using that microfluidic chip we talked about. It gently separates the sperm from, other stuff in the sample.
Okay, isolates the sperm gently. Then
Then comes a high-speed imaging, capturing millions of high-res images, creating this huge, comprehensive data set.
the IMAX movie.
Exactly. Then the AI gets to work analyzing all that data. It flags potential sperm based on their shape, their morphology, how they move, or even subtle signs of life.
And finally,
Finally, once the AI pinpoints those viable sperm, the robotic system carefully retrieves them. They're then ready to be used in assisted reproductive procedures, like ICSI, which is a form of IVF. It's designed as an end-to-end, largely automated process to minimize human error and maximize the chance of finding that crucial cell.
which brings us right back to that incredible case study. The couple, nearly 20 years, 15 failed cycles of Azoospermia.
Wow.
What was it about their case that Star cracked?
Well, the outcome was they achieved pregnancy, a successful pregnancy, which is just amazing. And this happened during a clinical trial of STAR at Columbia. The system literally identified and recovered viable sperm that all the previous conventional methods over all those years and cycles had completely missed.
They were undetectable before Star.
Completely. Imagine the emotional journey for that couple. After almost 2 decades of being told, essentially, no chance, it just highlights the profound human impact this kind of tech can have.
Absolutely profound. The clinical implications feel huge. You're talking about much better detection, right? Higher sensitivity, more specificity.
Exactly. Way beyond what was possible before. And that means for couples previously told biological parenthood was impossible, this offers a real viable option.
A new pathway.
A new pathway, and potentially, by being more successful up front in finding sperm, it could reduce the need for multiple, often invasive and emotionally draining treatment cycles. It's really shifting the paradigm.
It feels like it. And looking forward, you mentioned it's not just about finding sperm now. What's next for Star or tech like it?
Yeah, the potential is broader. While STAR's current focus is nailing sperm identification, the experts involved, they definitely see potential for expanding this kind of AI analysis to other areas, like embryo selection.
Ah, okay. So helping choose the best embryo.
Potentially, yes. This could be huge for patients who've had multiple IVF cycles fail even when they do get embryos.
Right, the implantation failures.
Exactly. Could AI help there? Could it improve the accuracy, maybe the efficiency of things like pre-implantation genetic testing? It really opens the door to much more personalized treatment plans, moving away from, a one-size-fits-all approach.
That personalization seems key. What about the bigger picture globally?
Well, think about standardizing care. AI-assisted tech like STAR could potentially help standardize the quality of fertility treatments across different clinics, maybe even different countries, raise the baseline, and as the tech matures, hopefully becomes more widespread, maybe it makes these advanced treatments more accessible. And potentially, if you improve success rates, reduce the number of cycles needed, maybe it even becomes more cost-effective in the long run.
That would be a significant shift. And what about research? Where does this lead?
Oh, it opens up tons of new avenues. You could see multimodal AI systems, ones that integrate imaging data with genetic data, with clinical history, a really holistic picture.
Hmm.
Predictive modeling using AI to better predict which treatments might work best for which patients. Maybe even real-time AI monitoring during procedures. It's like a whole new frontier is opening up.
It really sounds like it. And
Yeah.
Columbia University's role here seems central. You mentioned Dr. Williams, but the whole center.
Absolutely. Columbia University Fertility Center, they're often ranked highly, like #1 by Newsweek recently, but it's not just about rankings, it's their approach.
What's unique about it?
It's deeply interdisciplinary. They have computer scientists, engineers, reproductive biologists, all genuinely working together. STAR wasn't just cooked up in one lab, it came from that mix of expertise. Leaders like Dr. Zev Williams really championed that collaborative spirit. That's how you solve problems. Traditional medicine alone couldn't crack.
That makes sense. But let's be realistic. What are the hurdles, the challenges to getting this out there more widely? Is it mainly cost?
Cost is definitely a factor. I mean, this is a cutting-edge tech, specialized equipment. That's an initial barrier. But maybe even bigger is the expertise needed.
To run it, maintain it.
Exactly. You need trained personnel. And technically, its success still depends on the initial sample quality to some extent. So accessibility beyond major research centers is a challenge.
Okay. Cost and expertise. Any clinical challenges?
Sure. Careful patient selection is going to be key, figuring out who is most likely to benefit from STAR versus other approaches. And while the initial results are amazing, we need long-term data. Monitoring the health of children conceived using STAR is crucial.
Of course. Long-term follow-up.
Absolutely. And then there's the whole regulatory side. Getting widespread approval, setting standards for how it's used. That takes time and careful consideration.
Right. Safety and regulation always follow innovation. So, looking ahead, what are the priorities? Refining the tech, more research.
All of the above, really. Continuous improvement of the technology itself, making the AI algorithms even smarter, more accurate, reducing any false positives, maybe integrating it with other systems like time-lapse embryo imaging. Miniaturization could help with accessibility too,
Making it smaller, maybe cheaper.
potentially. On the research side, we need more studies. Comparative studies, STAR versus traditional methods head-to-head. More long-term follow-up, like we said. Optimizing the protocols. And of course, navigating those regulatory and ethical questions, setting clear safety rules and ethical guidelines for using AI in something so fundamental as creating families.
It's a huge responsibility.
It is. But the STAR system, developed at Columbia, it really does feel like a revolutionary step forward in treating male infertility, especially these really tough azoospermia cases.
That landmark pregnancy, after almost 20 years and all those failed cycles, it's such a powerful example of what this AI-assisted tech can do.
It truly is. This system, bringing together the high-res imaging, the gentle microfluidics, the smart AI, it's a really sophisticated answer to a problem that caused so much heartache.
It's definitely not just about one successful pregnancy, is it? It feels like a milestone. It offers real hope where maybe there wasn't much before.
Exactly. It sets a new benchmark, a new paradigm for how AI can be applied in reproductive medicine. It really could transform fertility care globally.
Giving more couples a chance to build their families.
Which leads to some big questions, doesn't it? As AI keeps pushing the boundaries in human biology, what fundamental questions does a breakthrough like this make us think about?
Yeah.
About life, about science, about the future of what a family can be?